Doc, yesterday we commemorated World Diabetes Day.
Yep.
For us, for some of us, we're not even paying attention to some of these things. And we have to be frank. What was the theme, or what is the theme for this year's World Diabetes Day celebration?
So the theme for this year's World Diabetes Day is access to diabetes care. And the focus really is to educate or do some intensive education for our health professionals and also empower our patients who are living with diabetes with the right information so that they can be able to live a normal life. Yeah, so that's basically
the theme
for the focus as well.
Okay, so I know that as organizations and associations, you may have activities that you would embark on to ensure that this particular theme is achieved. Are there any specific or are there any specified activities that for example, DEMSOG will be embarking on?
So yes, yesterday was World Diabetes Day, and as part of the education, yesterday DEMSOG actually launched the very first national diabetes guidelines, which is supposed to streamline the way in which diagnosis is made and then the kind of care that diabetic patients really require. On Friday, some stakeholders would also be meeting at Holiday Inn. There will be a continuous professional discussion, some CPD, what we call a CPD, to actually educate the public as well as the health professionals, and that will be streamed online on Zoom. Also, we'll climax this week-long celebration with a walk up the Bree Mountains as well, and that will be happening on Saturday, 6 a.m. sharp.
So activities are lined up for Friday and Saturday.
Yes, and yesterday
there was the official launch of the diabetes
guidelines, national diabetes.
Was it that we never had a national diabetes guideline prior to yesterday's launch?
So officially, prior to yesterday's launch, there are several protocols that are being used to manage diabetes across the nation, from the teaching hospitals to the other mini clinics as well as the districts. But it's always essential to have one manual that streamlines the diagnosis, recognizing the symptoms, diagnosis, and then appropriate referral. So this is just sort of streamlining everything so that if you're in the district as a health professional, when you find these patients or you diagnose these patients, what steps are you supposed to put in place before you refer to other facilities for specialized care? Okay,
so we had the protocols, but we had not consolidated it yet.
Exactly.
Now it is fully consolidated.
Exactly.
And when you happen to go to all of the health facilities that we have in the country, these guidelines, if you're diagnosed, will tell us what to do, or will tell health professionals in those institutions as to what to do.
Exactly.
That's nice, but somebody will ask, why should we be concerned about diabetes this early morning on the Happy Morning Show? Why I thought should a lot of people who are listening to us right now be concerned about diabetes?
Okay, thank you for that question. So, most of the time we hear about communicable diseases, so things like malaria, pneumonia, and all of that. Yeah. But over the past decade and over the past years, we've seen a high rise in non-communicable diseases. I'm sure you've heard a lot about hypertension.
Yes.
Diabetes is also one of the non-communicable diseases. Now, if you're looking at the prevalence, really, in Ghana, a meta-analysis was conducted quite recently, and we realized that the prevalence had been pegged at 6.46%, which is quite alarming,
6.46% of the total population of Ghana.
Of the population of the adults.
Of the population of the adults.
Those between 20 to 79 years. And if we are comparing this globally it's estimated that there are about 500 million people currently living with diabetes, And that will form about a little bit over 10% of the population of the 20 to 79-year-olds in the world, And there are estimates and predictions that these numbers are going to actually rise.
Right.
So, an estimate at 2030, that is going to rise to about 600 million, which will go a little bit about 11%. And then by 2045, it's going to go to about 11%. That will be around 700 million. The other interesting thing about the prevalence and the burden of the disease is that it's also estimated that over 240 million people are actually living with diabetes and are undiagnosed. They don't even know they are living with diabetes.
240 million people
globally
are living with diabetes.
Exactly. And they don't even know. You see, so they've not been diagnosed. They are just living their life.
So the estimate could be more.
Even more. And the other interesting thing about this figure is that over 90% of this estimate will be residing in low and middle income countries, of which Ghana is a part. So that's the reason why DEMSOC have decided to celebrate this World Diabetes Day over a 1-week period.
Okay.
And we are taking steps to help curb this problem.
Now, after talking about the statistics, let's get to the illness itself. How does one develop diabetes? How does one get diagnosed with the condition that you are now diabetic?
Okay. So before you are diagnosed with diabetes, you are supposed to, the patient will certainly show certain signs and symptoms. But the very first question we really need to talk about is what diabetes really is. Okay? And when you started, you were saying it's a sugar problem. So the real definition is that diabetes is a disorder or a disease where there's persistently high levels of glucose or sugar in your blood. And this is as a result of a hormone called insulin, which is either not produced in good quantities or it's in good quantities but it's not acting well. And now with this, there's a consequent dysfunction in how the body breaks down lipids, carbohydrates, and proteins as well. Okay, yeah. Most people some may not have any symptoms when they are pre-diabetic or when it is now starting. But most of the common symptoms that we are likely to have patients come in with is patients who pass large volumes of urine, okay, and are very, very thirsty. Other patients will also come and there's an increased appetite, so they eat a lot, what we call polyphagia. Others too would come with unexplained weight loss. I'm sure you would have heard of individuals who would say they've gotten a wound or a cut and it's not healing well.
Yes.
That may be an indication that this person has diabetes. Yeah.
Well, so in case you're listening to us, na and someone Dr. Rex Kwame Bunsu particularly with you be out takwaya sabia, you be out here now swatting tentem, you be over here hanasis to come do with brew, you be or ha Jones ultimate Jones giddy ujuna ho I want tiasie also to me kwaya sabia me ko hwuma wo say ampani ampano wanya asitriyare ne bi na entiremo de mane say ye wasitire bi a wo mogya mu a friend glucose na saa asitire no wo mogya mu a friend glucose no ye hormone bi a wo mogya mu a friend insulin wono e no regulate me boa so say ye kase wanya asitriyade a there are two things. It's either say sa honam akwa insuo no wo widie mu no hormone no entimi regulate sugar no wo mogya mu no asitire no wo mogya mu no entimi regulate ni ye either say watimi produce bi ebi wo ho na emum said ye be ya asitire ni betimi ewura widie mu ade ne dwuma yie no entimi ni dwuma yie anase ebi wo ho a wontimi produce bi kura na wontimi nya bi kura nti si ye ka se wonya asitire yade a na ne nkyire mu kakra no na doc am yeti ase se obo micron Ghana mu a ase said the diabetes and asitire yade edokro amanfo no ofa empanyimfo awmo madi be mfie aduno ekopem aduosun enkon so no a na kamia ise ohamu entichemu ensia de na womo ewo yade ni bi ewo mamu yade a na chese anu aden ewo se itimi etwa yani ehwe na nanka enkane no na yewo akwan ahodo a okwa yaresabia na ebia ye diagnose se wonya GI bia ye de efa so eni no enra enam DEMSOC so womo atimi de entotoe aba betudwa ama sese no baby abefa bia na yaresabia bia beko bia no ye guideline ba ko pene da ho nti ye diagnose se wonya yesitriyade ni bia anesi fo ni a doctor fo mu nyina wo kwan a womo edo befa so se de be ya bitimi aboa ama yetimi treat you. But doc, yamra me question that I asked regarding how does one develop it?
Okay. So in terms of development, we'll look at it from several angles. I rather talk about risk factors.
Okay.
What actually predisposes you
somebody
to
be
develop
diabetic.
Diabetes.
Okay.
And from one angle, we look at it as modifiable risk factors and non-modifiable risk factors.
Okay.
Modifiable risk factors now are risk factors that we can do something about. We have control over.
Okay.
One of it is smoking. Okay, so smoking is a known risk factor for diabetes. Hypertension in itself is a risk factor for diabetes. Obesity, okay, is also a risk factor for diabetes. As well as something we probably don't really consider much, extreme stress. So stress is, data now shows stress is one of those things that can actually also predispose you to diabetes, okay? And then if we look at the non-modifiable risk factors now, non-modifiable risk factors would talk about the age, the ethnicity of the patient. As you are aging, the risk becomes more and more. And then certain ethnic groups, I mean, we don't have too much data in Ghana,
okay,
but worldwide, we know African Americans are more likely to develop diabetes, Asian Americans and Hispanics, and as compared to their white counterparts, okay? And then some family history, okay? We know, say, particularly for both type 1 and type 2 diabetes, once you have a first degree relative who has diabetes, the likelihood of you getting it is way higher than the normal population. Okay. And then,
so once you've had somebody in your family line,
yes,
who has had diabetes before or who has been diagnosed as diabetic,
yes,
there is a higher propensity of you within that line also being diagnosed
exactly
with diabetes.
With diabetes as well.
Okay.
And then
so can we say that is hereditary? I mean,
yes,
you can inherit it from your line.
Yes. So that's what we would say the genetic associations of diabetes. Okay. And then we'll talk about our pregnant women as well. You can develop diabetes during pregnancy, what we call gestational diabetes. So if you've had a history of gestational diabetes, you may go on to become a diabetic later in the future as well. So these are the main risk factors of what predisposes you to develop diabetes.
But I mean, when you develop it, is it manageable?
Yes, it is manageable. That's a beautiful thing about any problem, if there are solutions to that problem. So yes, diabetes is manageable. The first thing is that once you have these symptoms, you don't stay at home. You visit the nearest hospital. Your doctor would take you through some physical examinations. And then we have some blood tests that we do. I'm sure most people would have heard that we say we'll do some fasting sugar for you, okay? Or we'll check some sugar after 2 hours after eating, okay? So we look at all of these things and then we make the diagnosis. When we make the diagnosis, it's two arms. Remember, I made mention of modifiable risk factors earlier on. So it means if you are watching your weight, okay, you have your ideal weight. If you are eating properly, not refined foods, a lot of sugar and the like. If you're also exercising, sedentary lifestyle is one of the risk factors that may predispose you. If you're able to quit smoking, reduce your alcohol consumptions, all of these will fall under the lifestyle-related interventions that you can put in place.
Okay.
Now, we also have medications that we can actually give you. And for that one, we have oral medications that we can give you. Or for some patients, we may actually give you the insulin that your body is unable to produce. And most of the time, once these things are done well, we're able to manage the patient well.
The doc can we say pretty simple. The ebema will be etumi enya diabetes no. Or say ye nia ye bitimi asachiremu ene ye nia ye ntumi nsachiremu. Niema ye yensamo ye bitimi ayo. Ene niema indi yensamo enya de bitimi ayo ho hwe. The all can say uyo bi a wotai enum cigarette mbwa. Uyo bi a wotai tenetena baby fa ako a mbwa. Uyo bi a stress ewo so a mbwa. Not just say a bit me predispose you said a bit me diabetes nibi. And a bio document yet as say a near any and someone into me home. Unini any a year family line. History woman we say obi anya diabetes wo mu da na say obi nya diabetes e wo mu eda na bio e bia ethnicity anase obobre ye fan say oye bruni anase oye bibini a but if you mom ye hunu say before no more predisposed to diabetes than abrofo no but doc me musa edidiemu eka ho ana because said na wo ka say unni processed foods in the keka because if you're in Ghana now, you cannot run away from processed foods.
Yeah.
What do we do?
That's true. And you see, once we are becoming an industrialized nation, would also begin to do what industrialized nations are already doing. So we become more busier. We are likely to patronize fast foods. We are likely to package quick foods.
Yeah.
So that we'll be able to get in something whilst we become economically active. And so with our diabetic patients themselves, nutritionist role is very, very key because even when you have diabetes, once you are able to watch your diet well, the diabetes is better controlled.
Okay.
Okay.
So diet is very critical.
Very critical. Into what we would say is when we are even managing our diabetic patients now, we use a multidisciplinary approach. It is not only the physician or the diabetologist in Kwane Sheno. Nutritionist has a role to play. We also teach them foot care. Even for patients, for one reason or the other, they lose their limb. We have structures in place to give them another limb so that they can be useful in society. In terms of the role of diet in the I mean, you cannot overemphasize it. And for those individuals, you have that family history. And you have to also pay attention to your diet. Well, so refined foods, a lot of carbohydrates. Our foods have a lot of oil in there, less vegetables, you see. So all of these things comes together to increase our risk of developing.
How do we prevent it? How do we prevent it?
Yes.
How do we not even? So, for example, the factor of our hereditary, we know that we cannot control it.
Yeah.
The factor of our age, we know that we cannot control it. But if somebody is at the age of 20 and we would want to prevent being or having diabetes or being diagnosed with diabetes, what do we need to do?
So the first thing will be the lifestyle-related changes, okay? And as I made mention, you have to be exercising, okay? We would say 30 minutes of brisk walking per day is good enough for your heart.
30 minutes?
30 minutes of brisk walking
a
day. So it's not the casual, you are walking side by side with friends and then just chatting, no sweating, and then you call that one physical activity. It has to be, you have to exert yourself.
Somebody is a culprit.
You need to exert yourself. And then, as I made mention earlier on, the diet is also crucial, okay? And then if you are staying away from smoking, both primary and secondary smoking, so you may not directly be the one smoking, but you probably may be an environment where smoking is going on. Yeah, it's going on. And then watch your weight as well. Now, the interesting thing is that once you are watching your diet, your weight will certainly be where it's supposed to be, okay? So it's typically the lifestyle-related issues. That's why when I started, I said, this is a non-communicable disease. It's not like malaria, where if you control the mosquito, breeding of the mosquito, you know that you are not going to have it, okay? This one has to do with lifestyle. And so once you are living a healthy lifestyle, even if you have that genetic predisposition or that familial tendency, you are likely not to develop it early enough, okay? But this year, the focus is to try and then educate the public so that they get to know the signs and symptoms that would send them to hospital, and also to empower the health professionals so that they would also have enough information to be able to pick these patients well and then diagnose them early so that the complications associated with that is reduced.
And that's what DEMSOC has been doing?
And that's what DEMSOC has been doing.
Doc, let me thank you very much.